name is Craig Noel. I'm a medical science liaison manager at the binding site, and my role is to provide scientific and educational support to clinicians and laboratory scientists who use the binding site assays. And today I'm going to be talking about the Hevylite assay. Clinicians use Hevylite to quantify the level of disease in patients with multiple myeloma. But myeloma is a tumour that develops in the bone marrow, and it usually consists of cells that produce a specific protein that is then released into the blood. Hevylite provides a unique way of measuring and detecting this protein. This is very useful because the amount of myeloma-associated protein in the blood is related to the amount of disease in the bone marrow, and it therefore provides a really good way of measuring tumour burden without having to use often very painful and invasive bone marrow tests. Hevylite also uniquely provides an indication of how myeloma is affecting the patient's healthy immune system, and therefore how the disease is affecting the patient's healthy cells and tissues. Haematologists will use Hevylite once a patient received a formal diagnosis of myeloma and is receiving therapy. Specifically, they use the assay to monitor how well or how badly a patient is responding to that therapy. They also use it to detect if a patient's disease is returning when they are in remission. Hevylite also has particular value when the myeloma cannot be quantified by conventional methods. Hevylite is a very sensitive test and can therefore detect extremely low levels of disease compared to conventional methods. This extra sensitivity enables clinicians to more accurately determine how well a patient is responding to therapy. It also means that relapsing disease, so when a patient's disease is returning if they're in remission, can be detected at very early stages. The other key benefit of Hevylite is that it provides a unique and powerful way of measuring how myeloma is affecting the patient's immune system, and this is a very important measure of disease severity. Because Hevylite provides a more accurate indication of disease status compared to conventional methods, it means that haematologists can use the assay to make better informed clinical management decisions. So, for example, it can help inform the most appropriate time to perform a specific intervention, such as a stem cell transplant, initiation of the next line of therapy, or indeed when to perform a bone marrow test to determine if a patient has residual disease. Thank you for watching, and if you have any further questions or need any further information about Hevylite, please contact the binding site.